Hi, my name is Lily, and I am in a position, or I've been put in a position where I've learned about many programs that assist family health caregivers, or just caregivers in general. And I wanted to, I eventually will start an organization, a nonprofit organization, but for right now, I just want to share some of the info that I've learned. And so I'm gonna on the screen you see and this is only for Snohomish County. So if you live in Snohomish County, if you're a caregiver and you live in Snohomish County, then this particular program applies to you. Now the person that you're taking care of can live in any county, can even live out of state as long as you're their primary caregiver. So I want to say that's number one. Number two, I also want to say that this program here for the caregiver, it's not based on income at all. And so, and again, this is only for Snohomish County. They don't consider your financials, your care receivers' financials either. It's just offering you a little bit of support, because you're not getting paid to be a caregiver. And so, anyway, that's just a little bit, and I'm sure you're gonna have lots of questions, and if you do, just, feel free to ask. So I'm just gonna read a little bit what I was given. So follow with me. The Family Caregiver Support Program, and the initials FCSP, was established in 2000 and is available in every county in Washington state, offering unpaid family caregivers tailored services and resources. Now, that is true. This program exists in every county in Washington state, but all the counties do not call it the same thing, do not call it the Family Caregiver Support Program. They might have renamed it, so you'd have to look for it. And the other thing is that their services vary in what kind of support they give caregivers. And so yes, you'd have to go by county. And I'm just, again, this is just for Snohomish County. So there are two goals for the FCSP program: to provide information and support to unpaid family or other unpaid caregivers who are not involved with the Medicaid funded long term care service system, and to postpone or prevent the need for more expensive forms or care for adults, um, like caregivers needing ongoing care or supervision. So here it goes on to describe who is a caregiver, because the name of the program is called Family Caregiver Support, but you don't actually have to be a family member to the care receiver. So for FCSP, a caregiver is a helper. Many don't recognize themselves as caregivers. Spouses, partners, sons, daughters, grandchildren, extended family members, and friends and neighbors can be a caregiver. So if you're taking care of a neighbor or a friend, um, you're a caregiver. Support provided can be minimal, and providing personal care is not a requirement for you to be considered a caregiver. Recognizing the caregiver role or not, the amount of caregiver burden and stress can grow quickly when a caregiver must balance the time spent on caregiving with work, family, and personal responsibilities. And that is so true. Um, when you're taking care of somebody else that you were not expecting to take care of, that becomes a stressful situation. And I completely understand this, because I'm a caregiver myself. Core values of this program are embodied in the following three statements: you are not alone. The best care you can give your loved one is your own self care. And healthy families are connected to community. And so that's kind of what I'm trying to establish: a community where there will be resources, but there is also going to be support. And this, the organization that I have in mind, different, I think. And I'm really excited about it. And I'll talk about that when it's a little more planned out. Anyway, going back to the FCSP program, uses an evidence-based assessment tool that suggests specific services designed to make a difference and leads to a tailored care plan meeting each caregiver's unique needs. Services vary by support needs. For more information or if you have any questions, contact us today. So that is the first page. And I'm going to go on to share the second page. And let me enlarge that a little bit here. Okay. And so these are the agencies that you can go to or just simply call. And these are the agencies that you will be dealing with. And then um, ref- they will put the referrals together and they will send them to the appropriate company that provides the service that you choose. So let me again stress that this is something for the caregiver to lighten their load a little bit. Okay. So the Family Caregiver Support Program agencies in Snohomish County are Homage Senior Services, Stille Valley Center, which is located in Arlington. I'm not really sure where Homage is. I think it might be in Everett, but I'm not 100%. And then the Alzheimer's Association, and I believe that they're either in Everett or Linwood. Not 100%, but again, you have the phone numbers there, and they will share. Um, they will share whatever and answer whatever questions you may have. So this is the program eligibility. Eligibility. That's a tough word for me to say. The unpaid caregiver. So that's the thing. You have to be unpaid. You cannot be paid for the services that you provide. So the unpaid caregiver must be 18 years and older and actively caring for a person age 18 and older who has a functional disability. The caregiver must provide support and without financial compensation. So that's important. The care receiver must not be receiving Medicaid funded long-term care services. So the person that you take care of cannot be receiving Medicaid funded long-term care services. Possible supports available through FCSP. So they'll give you information, assistance, and referral, personal consultation, support groups. I heard the support groups are phenomenal. Caregiver assessment and care planning using the evidence-based tailored caregiver assessment and referral, which is called T-Care process. All FCSP caregiver specialists are trained and certified in T-Care. So the caregiver specialists, I believe, are the people you'll be calling and contacting to discuss T-Care. Respite services and enhanced services accessed via the T-Care process, and uh, the services could include limited in-home care to allow caregiver a break during the day. So they'll send you someone to take care of your person. Um, and I believe it's an hour a month. I'm not entirely sure, but that's a question that you can ask. House cleaning, I believe it's for an hour a month as well. Not entirely sure. Massages, for the caregiver, and the average is about an hour a month. Emergency button monitoring system, home delivered meals, and more. Caregiver workshops and events, which are really, really informative. I've been to one myself, excuse me, and community presentations. Um, I want to share that I am a caregiver, but I'm also uh, a healthcare provider. It says massages for caregiver, and I am part of that program where, as a licensed massage therapist, I do give massages to caregivers in this program. And so that's the end of the presentation. Sorry, I'm going to cough again. I'm not used to reading so much out loud. Anyway, so this is the first video, and there's a series of videos that I want to put out about all the information that I have. The next one, I'm hoping to interview a lady because she has an interesting program, and it's for people who have, I'm sorry, diabetes, and it has to do with shoes for people who have diabetes. So I definitely want to um get her on and have a discussion with her. Um and so I think I'm just going to leave it there. Again, if you have any questions, please feel free to post them below. I'm going to post this on YouTube, and so hopefully you'll join the channel because a lot of information is going to be forthcoming. And again, if you have any questions, please be patient. I'm the only one who's going to be doing this for right now. And so it's just me, myself, and I do work. And again, I am a caregiver myself. So thank you again. And I might add some things in the description. So please read the description below. Thank you so much.